was pretty busy. We had a lot of emergency appointments, especially with Christmas. Things are coming in at the last minute and we're trying to get everyone in before our clinic closes for the holiday. And we did have one dog who came in this morning for vaccines, and also they wanted us to check out some spots they saw on the eye. This is fun too because Carmen used to work with the ophthalmologist, so
oh, okay, this is your specialty.
Yeah.
I like it.
It's fun, we like to work on these cases together. So we're just gonna start with a basic eye exam from a distance. So checking to see if he's visual in his reflexes. So he blinks. So this is all very normal. Good boy. Make sure his eyelids close completely, which they do. Good boy, Sally. Good. Now he's a little stressed, but they do constrict when I shine a light in them, so that's normal. So he can see, he can close his eyelids normally, he can see light, so whatever's going on is not impacting his vision, which is great. And I'm just going to check his tear production in both of his eyes. Sometimes pets can get dry eye and they don't make enough tears, and that can cause them to have excessive discharge. Eye cases can be super rewarding once you start treating them. Sometimes a pet will come in for something that looks really, really bad, and after treatment, when it goes back to normal, I find that is always really rewarding. Our tear production was totally normal. There was no evidence of an ulcer when we did our fluorescein stain, and our eye pressures were totally within the normal limits. His owner said that she noticed a lot of white spots in his eye. Now, when I shine a light on, I can see those little pinpoint white spots, but there's also a lot of blood vessels that are coming over the surface of his eye. Shepherds can get a condition called pannus, where, for whatever reason, genetics, immune mediated, their body will have those infiltrations of blood vessels across the surface of their eye. So I'm most suspicious that's probably what he has, because we don't have an ulcer in his eye. I'm not sure about the spots though. I might just see if Carling wants to come have a look.
Oh yeah.
Because I do feel like the blood vessels are...
I think it's pannus.
Yeah.
I agree. It looks
I just don't know what the
pannus.
white spots, like if they'd be just unrelated corneal dystrophy or mineralized. Like, is it related to the pannus?
I don't think so. I think it's unrelated.
Yeah,
it's just complete
areas
of
mineralization.
Yeah, and I think it's like incidental.
By doing all those testing, we've ruled out a lot of other causes of seeing those types of changes in his eyes. And so because of that, and knowing that he is a bit of a shepherd cross, we did diagnose him with pannus disease. Pannus in the eyes is when we have probably some kind of immune-mediated condition where we get those blood vessels that come in over the clear part of the eye. If we leave it untreated, those blood vessels can actually cover the whole surface of the cornea, so that can really impair our pet's vision. So we have gone ahead and started him on a steroid drop and another little immunosuppressive medication called cyclosporin. We're hoping to start out a little bit higher at the beginning, and Sally's going to come back in 1 month and we'll see how those blood vessels are looking. And then we had our 2 eye appointments come in with a skin appointment and a dog having an allergic reaction all at the same time, as it usually does.
So we're doing a lump removal on this dog. This lump was infected a few weeks ago and improved with antibiotic therapy. So I actually don't know what this is. I don't think we've ever done any actual testing on it. I'm just removing it. We're keeping just in case they change their mind down the road. So I don't know exactly how much this is really affecting his quality of life until it gets inflamed and angry. Up until that point, I think it probably doesn't bug him too much, but when it gets inflamed, of course, then he's looking at it, etc. So that's the argument, to instead of deal with it, band-aid therapy, to just actually deal with the underlying problem, which is the lump itself. So it's either a benign cancer or a malignant cancer. But the ones that we only worry about are generally speaking, are the malignant ones that are going to spread to internal organs. Benign lumps, as long as you remove said lump, they're not going to cause other problems. This area is kind of scary because there's like arteries and jugular veins and stuff underneath here, so can't be cutting anything really deep. So I'm trying very hard to just get my fascia and subq separated and leave the muscle behind. I don't want to disrupt his ability to move his neck around. So this is a little trickier lump removal than average, but it's fun.
You can see the pulse of the jugular.
That's why this is terrifying, because I'm very close. I really don't want to put a stitch inside this thing. Trying my best not to do that today. With a lump removal or any sort of work that you're doing when you create an area of dead space, there tends to be a lot of fluid produced as the body's trying to heal that. So the drain is managing that fluid production, otherwise you get a huge lump under your incision. Over the next few days, all the fluid from underneath this dead space in the wound is going to drain out of that little penrose that we just put in there. So this will be pretty gunky and yucky, and then we'll remove that next week. And then the stitches will stay in for the full 2 weeks. That looks so much better, sweetie. Good, I'm pretty happy with that.
Dental. The teeth are gross. We would like to remove a lot of the teeth because they're mobile. Mobility is bad. So pretty much everything is going that's left. Like this shouldn't be black. This should all be like this. So that means there's air in there. So like things can fit through. There's no bone. Like the bone should be all the way up here. So it's all just been ate away by bacteria. But we're removing all of those. So 3, 4, 23, 24, 25, 26, 26 teeth. That's all she has left. Oh, it's so stinky. Even with the mask on, like. These dentals are easier, but they're like this dog's been in a lot of pain. Like when they're this eroded, it like, you know that it's not good. Like that's a 3-rooted tooth. I should have to like split it to be able to get each individual root out. That's another 3-rooted tooth. This dog had full mouth extractions. The teeth were pretty gnarly, lots of dental disease. Most of the teeth were all mobile, so those would have been painful all the time. So now hopefully the dog should feel a lot better, feel a lot happier. She'll just eat soft food for the rest of her life, and the owners will have less of a smelly dog at home. This dog didn't have any extractions. Looked really good for being 9. We're done.
Ta-da!
Teeth look perfect. They
Yeah,
just go ahead.
Grade 2 dental disease, but everything cleaned up well. He had no gingival recession, no bone loss, no abnormalities on x-rays, so he gets to keep all his teeth. He's naturally missing a few, but he's not going to miss any more because of us today.
We got all of our pets out by lunch, which was great. Our afternoon, we've squeezed in a couple of same-day sick appointments, which always happens. We're hopefully going to, get everyone that we can seen before Christmas, because our clinic is going to be closed for the next couple of days for the holidays. I think we're all really looking forward to just being able to take a step back and spend some time with everyone's families and hopefully get a little bit of relaxation in for the holidays.